Coming up on Medwatch today, taking the questions out of colonoscopy, how this simple procedure can stay ahead of, even prevent colon cancer. A worldwide shortage that's hitting us here at home, how Community Medical Centers is staying ahead of a limited IV supply as well as some narcotic drugs. Plus, setting yourself up for success, how ergonomics can help you work the right way and avoid injury on the job. Hi there, and thanks for joining us. I'm Julie Musgrave. Colon cancer is the third most common cancer in the United States. But did you know it is preventable? And the best way to catch it in the precancerous stage is a colonoscopy. Here's a behind-the-scenes look at the procedure, and you may be surprised just how easy it really is. Mark Osborne is going from nurse to patient and practicing what he preaches.
This will be my fourth colonoscopy.
Mark is a clinical nurse manager at Community Regional Medical Center.
Almost no one should ever get colon cancer.
He says colonoscopies are designed to find the problem before it actually becomes a problem.
We take a little camera, we go in through your back passage into your colon, take a look inside, and see if we can see any risks for colon cancer and try to treat it appropriately.
Dr. Chowdhury is a gastroenterologist in Fresno. He says those risks often go unnoticed.
One of the most important things that we are looking for is something called a polyp. A polyp is a little growth that forms within the colon, and if that polyp is not removed, over time it becomes cancer. Most of the time, polyps do not have any symptoms. They do not cause any pain. They do not cause any discomfort. They do not bleed. Most of the time, patients are unaware of having that they have a polyp.
The outpatient procedure takes between 15 and 20 minutes. You'll need to do some prep work the day before. No eating, just clear liquids. Then down a drink that helps clear out your system. You can get it done with sedation or without, like Mark.
And it does feel a little weird, but like for instance, if they take a polyp out, you don't feel that at all.
That's because not many know there are no pain receptors in your colon. Dr. Chowdhury says the only discomfort you'll feel is a bit of cramping.
It is one of those success stories of cancer prevention that we have achieved over the past decade.
Colonoscopy is recommended starting at age 50 unless someone in your family either had colon cancer or had polyps removed. Then you need to start earlier.
My father had colon cancer at age about 52, which is my age right now.
That's exactly why Mark is staying on top of it. Mark now gets a colonoscopy every 3 to 5 years.
I saw what my dad went through, and it looked very painful. He's still around, but it was very painful, and I've seen other people that have gotten it, of course, being in this business, and it's so avoidable. Why not just avoid it?
This time, they did find a few polyps, but they're taken care of now. Mark calls it a small price to pay to save his life.
With our technology, it's off the charts. It's totally fantastic. It works. It's effective. You will go home and be with your family for at least another 25 years if that was the only thing that was going to get you.
Colonoscopy is considered extremely safe and effective. To learn more about getting yourself screened, talk to your primary care physician. Believe it or not, hurricanes on the other side of the country are having an impact on supplies used every day in hospitals worldwide. Here at Community, though, they are staying ahead of the game to make sure patients don't miss a thing. We are talking about some shortages that the medical industry is dealing with right now. What exactly are we seeing?
We are basically experiencing IV shortages to an extent that we have not seen in decades. This is mainly an effect of the hurricanes we had in Puerto Rico. a lot of facilities have had to shut down, and based on that, the manufacturing process got disrupted, the supply chain has been impacted. But overall, we are taking good care of our patients. We have a process in place, and that's how we are managing our IV shortages.
It is a nationwide issue, but how are we seeing it here locally?
The impact is big, even locally. It is not just nationwide, it is a global issue right now. From our perspective, materials management and pharmacy has done a good job in terms of putting things in place whereby we do daily counts of all the IVs that we have. The technology is to such an extent that we are able to switch the bags and give alerts to our physicians, letting them know instantaneously our levels of which bags are available and which type of fluids are not available, and what are the alternates that we would suggest that they pick from.
So the materials aspect of it obviously is very important, but there's also another shortage. You guys are seeing this also with narcotics. What's going on there?
Oh, narcotics is one of the other elements that we are dealing with, but I personally feel the IV fluid shortages prepared us for narcotics. With narcotics, it's a different cause. This comes from FDA. FDA mandates and visits these facilities and gives them the green light to compound. There has been some disruption with narcotic supply chain, so we've been allocated the amount of narcotics that we get. So again, we are doing a fabulous job of pulling through our counts on a daily basis, keeping our physicians in the loop, letting them know what alternates are available. And in what denominations they are available. So that's how we have been managing our pain control for our patients, and so far the impact has been minimum. It's a lot of work that we do with the collaboration of our physician partners and our nursing leaders. We have addressed this quite well.
And what's the outlook? Are we going to see an end anytime soon?
I don't have the crystal ball, but I can tell you the IV fluid shortages will last through the quarters to come. In terms of narcotics, definitely it'll be through the next years. We will see the shortage continue for the rest of this year, and maybe into the first quarter of next year is when the supply chain should improve.
But important and comforting to know that you guys are keeping a close eye on.
Yes. I can assure you our patients are well taken care of. We have a solid team of physician leadership, and with all this teamwork has really kept our physicians abreast, and that's how we are handling our process.
Okay, good information. We appreciate your time.
Thank you.
Coming up on Medwatch today, next season we'll see the return of a flu vaccine that doesn't involve needles. Plus, our healthcare hero who takes on a role of support for patients in times of crisis.